So my name is John Michael Carter, and I'm the CEO of ChartSpan. The company's origins were really from my brother, who was an 18-year practicing clinician who just thought that patient engagement should really be the focus of what healthcare is about. And so he and I built the company together. We're very much a family-run company. Two brothers who had an idea, who built the company out of our garage, and today we've become the largest chronic care management vendor in the US. So ChartSpan is known as a care coordination service. A lot of people don't know what care coordination is. Simply said, it's helping patients between office visits. And that's important because doctors see you at the moment that there's an inflection in your healthcare, when there's a problem. They don't see you at 2:30 in the morning. There are times that you need to help and bridge that care gap between office visits, and that's exactly what we do. And we act as an extension of your doctor and support you every month.
ChartSpan is a service which does chronic care management for us. Biggest issue we have with the patients is that most of our patients are, when they visit us, it's an episodic care. They come and see us and then they go out. And then until they come next time, there is no continuity of care in between. And quite a few times these patients are using emergency rooms as their way of getting care. And the biggest issue with that is that could be prevented. It increases the morbidity for the patients, and it also increases the cost of care. So ChartSpan basically provides the patients and us a service which is unique. It's a chronic care management, and patients are being contacted by a nurse from ChartSpan on a regular basis. They also do a lot of med management for them, because biggest issue we are having is a lot of patients have a lot of medicines at home, and some of those medicines are expired. Some of them, those medicines were changed and they never disposed of those medicines. So it helps prevent these medication errors, helps us physicians look at something from patient's perspective. Then what are their needs, which we may not discuss in an office setting with the patient.
So there's a lot of features you get when you sign up for a care coordination program. Probably the most important is the availability of a nurse 24/7. So in the middle of the night, if you have an emergent question or an urgent situation, you can call us and we're there to support you. You might be on vacation and run out of your prescriptions and you need an emergency refill. We're there to help you. 24/7 access to a care coordinator who can help support you no matter how big or how small the problem is. Another important function of the program is to really make sure that you're adhering to the care goals. So often we have a condition. We might have diabetes, high blood pressure, high cholesterol. Our job is to make sure we're supporting the care plan that you and your doctor have developed together, and making sure if there's an obstacle, we help you get over it. It may be something as simple as needing a prescription refill, or something like needing help with transportation to get to an appointment, or just a question that you have about a symptom or condition that you have that we can help answer or direct you to the right person who can answer it. One of the best parts of this program is that it happens at your convenience. It's not always convenient to make an appointment, find transportation, find time in your day to go to an appointment. With the care coordination program, it happens when you're at home, at your convenience. You take the call when it works for you, or call back your care coordinator when it's convenient. If someone calls you from Graves Gilbert and they're a care coordinator, that is your care coordination team reaching out to you to see if you want to enroll in the program. Once you do enroll, what you should expect is a monthly call from your care coordination team checking in with you. And if it's not convenient to talk at any specific time, you can always call back at your convenience and talk to your care coordinator. If you have consistent, constant care, and not just reactionary, not just going to your doctor when you have a problem, but in a preventative way, making sure that you're talking about the smallest things with your care coordination team so we can get out ahead of it, that's the primary benefit of the program, and that's how patients benefit from the program.
This is the next paradigm shift, where we are going to be more proactive taking care of the patients and more proactive in taking care of them at home rather than coming to our office or to the hospitals. Medicine is becoming more patient-centric, and this is one of the ways how we can keep patient at the center of the care.
We know for a fact that patient outcomes have a dramatic impact if a patient is enrolled in a care coordination program. We know for a fact that we've seen mortality rates reduced. We're saving lives every day with this program. We're keeping patients out of the hospital. We know that we're improving outcomes for patients with diabetes and high blood pressure and high cholesterol. And most of all, we're preventing bad outcomes by making sure patients stay healthy.